we're planning a breast augmentation surgery, there are a few choices we get to make, and one of those is where that incision goes. The choices are underneath the arm, around the nipple area, and underneath the fold of the breast. All of those can heal nicely, but there are pitfalls with certain ones of them. The one underneath the arm, I'm not a fan of, and that's because when we're going from under the arm all the way down through the side of the breast into the place where we make our pocket, we damage or weaken the tissue on the side of the breast. Now, when patients sit up and look at things, they look fine. But when they go to lay back, those implants separate and fall off to the side because of the weakness of the tissue there. So why set ourselves up for a problem just by the placement of that incision? The one around the nipple, I actually used to use quite frequently, but there's been a couple of things that have come up that make a difference. First off, not everybody has a nipple complex that's big enough that I can put my instruments in or that I can put my implant in through that direction. So technically and anatomically, sometimes it's not a good choice. But the other more important thing is over about the last 10 years, they've figured out the breast tissue naturally contains bacteria. And if we're making the incision through the nipple, we absolutely have to go through the breast tissue to get to where we put the implant. And as I'm pushing that implant in, bacteria can kind of attach to the implant and cause problems. They don't necessarily make for a rip-roaring infection, but very often they create kind of an inflammatory response inside that results in capsule formation. And that capsule formation is significantly higher if we go through the nipple than if we go through the fold of the breast. The incision along the fold of the breast is the one that myself and my partners use almost exclusively, and it's because it has less complications. First off, I can make that incision as long as I need to get the implant in safely. Obviously, I don't make it any bigger than I have to, but I can extend it if there's a reason. Also, when we're going through the fold of the breast, I go under and around that breast tissue so we don't get that exposure to the bacteria. And that way we don't set up that inflammatory process, and our incidence of capsule formation is very low.